Hi everyone, thanks for joining us this afternoon. My name is Chrissy Giuliano. I'm the director of the Big Cities Health Coalition. Just to answer some questions that are on the screen before we get started, everyone should be hearing the audio through the computer. We do not have an open phone line, and any questions or technical difficulties, you should go ahead and use either the Q&A box on your screen or the chat, and one of us here will get back to you. So again, thanks for joining us. I'll be moderating our discussion today and introducing you to the coalition. And then my colleague Megan McGinty, who's the Deputy Director of the coalition, will walk you through some highlights of the platform and our new policy and practice pages. As is Murphy's Law, we're actually having a few technical difficulties with the platform due to a data upload yesterday. So if you are playing around with it right now, you may run into some issues. Do know that we know that, and we'll be fixing it as soon as we finish up here. So after the presentation, we will answer questions as time allows. You can put your question into the Q&A box or the chat feature. We have both up there. We'll read it aloud and answer it again as we can, during the Q&A period. We may not be able to get to everyone's questions. We'll cover as many as we can, and then we can also follow up with folks, or you can follow up with us, as questions arise. So with that, we will get started. So the Big Cities Health Coalition, or BCHC, was founded about 15 years ago to provide a forum for the leaders of America's largest metropolitan health departments to exchange strategies and jointly address issues to promote and protect the health and safety of the residents they serve. Our mission is advancing equity in health for present and future generations, and our vision is to create healthy, more equitable communities through big city innovation and leadership. So our member cities are on here. You see we have 30 members. Generally speaking, our main touch point in health departments is the lead health official. And of course, that person represents their entire local health department. So currently, our jurisdictions impact 55 million people, or about 1 in 6 Americans. Before we get to the platform itself, we want to thank our partners and funders in this work. Funding for the data platform, this project itself, comes primarily from the U.S. Centers for Disease Control and Prevention through a cooperative agreement with NACCHO, the National Association of County and City Health Officials. We'd also like to thank the De Beaumont Foundation and the Robert Wood Johnson Foundation, both of which provide additional support for the project as part of their ongoing support to the coalition as a whole. Finally, we are grateful to the many experts who continue to weigh in on this project in each iteration, most especially our member city staff who provide data and guidance in the process, and without whom really none of this could be where it is. So now I'm going to turn it over to Megan McGinty, who will walk us through some of the platform features.
Thanks, Chrissy. Okay, so it cannot be emphasized enough that effective public health practice depends on having reliable and current information regarding the health of every community. Without it, policies can neither be targeted to those populations most in need, nor can the impact of policy change be measured. Data is also critical to partnerships with community-based organizations, clinical providers, and other government agencies. Most national data on health status, however, make comparisons at either the state level or sometimes at the county level. Health leaders have expressed a continuing need for more comprehensive data and comparative perspective on the most pressing health issues facing the nation's urban areas. Many cities struggle with significant health disparities, but often lack the information needed to help the public, policymakers, and even other health officials tackle key winnable health battles. It should be noted that the data in the Big Cities Health Inventory are either actual counts or survey data. They're not model data or small area estimates, which is a key difference from other initiatives like the 500 Cities Project. So in the Big Cities Health Inventory, There are over 1,800 data points. This data tool provides a snapshot into the state of urban public health. The more than 1,800 data points can be compared across cities, including more than 50 health and socio-demographic indicators. A cross-section of big urban cities, their populations are more alike than they are different, and the dataset is the first of its kind to provide these data in a comparable manner at the city level. For the most part, the health indicators included on our platform have come directly from our member cities. Some key exceptions are preschool enrollment and high school graduation rates, as well as a number of other demographic indicators, which come from publicly available data sets using standardized city codes. While these codes do not always track jurisdictional lines exactly, they give us the best available data for a number of indicators. As we've mentioned, to the best of our ability, we've used standard definitions and adopted a methodology that allows for comparability across cities. For the most part, we've left out data that are not fully comparable. More information can be found on the methodology page of our website, the BCHI website, that includes a glossary of terms. Suffice to say here that we've made decisions with the advice of our advisory committee about whether to use age-adjusted versus crude rates, for example, according to standard practice and with the guidance and support of advisory committee members, which includes experts in our member health departments. So the platform was designed to be understandable and accessible for anyone who wants to explore the state of public health in urban America. It can also be used as a tool to help policymakers prioritize scarce resources using available data. Providing access to these data is the best way to expand and improve upon it, and we encourage outside use and analysis. Users can sort data by health indicator or city, and then by race, ethnicity, or sex, or even year. The data charts can be easily shared directly via social media, or you can download them in a number of formats. For the first time, cities can easily look at their peers to determine who's ahead of the curve and start to ask why. So you can see here a picture of our data platform. And as I mentioned, we have a variety of indicator categories. There are 11 indicator categories, which you can see expanded upon here on the left. Let's see if I can. Yeah, there we go. And then if you click on a particular indicator category, such as I've done here with behavioral health substance abuse, you can see the particular indicators in that category listed out. So this arrow is for the indicator categories, and then you can see the specific indicators that we have. So as I mentioned, this is completely open access. You can download all of the data from the data platform, and there are two ways that you can do it. Over here on the left, you can download the entire data set as a CSV file, and this is ideal if you're a researcher, an academic, a student, and you're looking to do analysis of the data and you want all of the data, all the indicators, all the cities, all the years. You get the full file here, and then you can just import it into whatever statistical software you're using. Alternatively, if you're looking to, and your interest is in just a subset of the data, for instance, if you're just interested in opioid-related overdose mortality, you could download just the indicator CSV. So that's just a file of the opioid-related overdose mortality data. And then, as I mentioned, we have share tools. So you see here on this screenshot that we're on the opioids page. If you wanted to share this graphic via social media, you could click on this download and share button, and you could share it via Facebook or Twitter, or you can download the image if you want to use it for your own purposes. Just happening for you. Okay. Okay, so now I'm going to take us to the live website to show you some of the new policy and practice pages that we've created. Okay, so here is our data platform live, and I am on the opioid-related overdose and mortality page, and you can see up in the upper right-hand corner there's a little magnifying glass, and there's a hyperlink that says local policies and practices. So if you click on that hyperlink, it will take you to what we are referring to as our policy pages. And we've launched 3 new policy pages. So this is the one related to combating the opioid crisis. There is also a policy page related to mitigating tobacco use, and there is a policy page related to physical activity and obesity. And so these pages compile evidence-based or evidence-informed and best practices that exist related to addressing the particular public health challenge described on the pages. And so we've drawn from work that's already been done by a great number of organizations, such as the High Five and the 618 initiatives of CDC, as well as Winnable Battles and the work of City Health, to identify policy interventions that can be used for this page to address the opioid crisis. So up here at the top, we have a summary of kind of the overall issue, and then we get into policies and practices that can be used to address the opioid epidemic. And then we have examples from our member cities. So on the pages, in some places, we have case studies going into an in-depth exploration of what is being done in our member cities. In some cases, we have, so I'll click on here you can see we have information on what's being done for safe prescribing in San Diego County. And then in other cases, we have blogs and resources directly from our member cities. So here's an example of that. This talks about naloxone access in Baltimore and what they've done in order, with the commissioner's standing order for naloxone, what they've done in order to expand naloxone access throughout Baltimore. Okay, so that is the demo of our new policy pages. So as I mentioned, what is on these policy pages are evidence-informed practices, and there are stories and examples from our member cities, and these policy pages all link to existing data that we have on the platform. So where we have data on a particular area, for right now, you'll see that there's the opioids page, there's the mitigating tobacco use page, and there's the physical activity and nutrition pages. But more stuff is coming soon. So just to give you a preview of that, over the coming year, we're going to be adding more policy pages. We're going to be adding more data, and we're going to be adding more indicators. So where data is missing, where it doesn't exist for certain years or certain cities, we will be filling in those gaps. We will be looking to expand the indicators for which we already have data, and then we will be adding new policy pages based on the data that we have. And just as a preview, the policy pages that we plan to release relatively soon are ones related to universal pre-kindergarten and paid lead, as well as lead. In addition, we are going to be launching an opportunity for students. So I mentioned that the data is open access and available for anybody to use. We really truly want to encourage analysis of this data. And we know that students and faculty have reached out to us and told us that they're using it in their classes or in their capstone projects for MPH programs, but we don't often get to see the results from those projects. So we are going to be launching a small grant opportunity for students to do analysis of data on the Big Cities Health Inventory. And then for that work that students do to be shared with us. So you should check back at the URL listed here after Thanksgiving and the opportunity will be posted. We will be encouraging students to submit applications on anything that is on the data platform. So any of the indicator categories, any of the indicators, whatever is most of interest to students, they can do analysis on. We will be giving preference to things that relate to our organizational mission, as well as things that look across all of the cities. So share this with your students if you're faculty, or share if you're students, please consider applying. Here is the resources related to Big Cities Health Coalition, our Twitter and Facebook account, our blog, and where you can sign up for our newsletter. And if you have questions about us overall or specifically on the Big Cities Health Inventory platform, you can reach me here at this email address. And with that, I'll turn it back to Chrissy to moderate some questions.
Great, thanks, Megan. So we have a couple questions here in the chat, and so Megan and I will answer some of these together. I'm going to start with the bottom one, the timeline on the injury violence prevention policy page. I would say early next year, January, February, maybe I should say February. We have some information and we're working on building up that page. So I would say, again, early 2017. Do check back, and then also I'll just continue to plug our newsletter. If you sign up for our newsletter, when we add new things, we let people know. So sign up for the newsletter, follow us on Twitter, and we publicize this stuff as it's updated. Then we have some questions here about the type of data skills needed and additional data. So any data that are on the platform sort of as of now or in the next month or so as this project will roll out, we are happy to entertain proposals on. And again, that information should be up in the next week or two, and it'll just outline that we're looking for, some information around what the analysis should be, what people want the analysis, what they want to do with the analysis. I would say, and I'll let Megan answer this too, but it's the sort of level of skill one person would need depends on the level of analysis they want to do, ranging from simple to less simple. Yeah, you have anything to add? Okay.
Yeah, so I mean, certainly you could do a simple analysis, but if students have advanced statistical experience, then they could do a multivariate analysis. We have no opposition to merging our data with other data to do more complicated analysis. So, I mean, if there are specific questions people have about ideas that they're considering, I'm happy to take those questions now, or, you could probably be best if you emailed me and then we could discuss it. And I think Chrissy's got some follow-up.
Yeah, and in regard to that, this is sort of a new thing we're trying with this mini grant. It will not be a lot of dollars. That doesn't mean that people can't use this data set to do research, even if we're not, subsidizing it. So you should definitely reach out to Megan or myself to talk about that. And again, as she pointed out, you can download, the entire data set.
So we have a question from Mary Beth, and I just wanted to make a clarification. So the question was about additional data and the pre-K data. So just to clarify, the data about pre-K enrollment, I forget the exact name of the indicator, is already on the platform. What is being added are new policy pages. So all the data that we have to date for all of our member cities is on the platform. Literally, as soon as we get data, we QA it and we upload it. So whatever is up there is always the most current data that we have available from our members. Over the coming year, we will be adding new indicators that don't exist on the platform that we've never had before. But when I was talking about universal pre-K and when I was talking about paid leave, those are policy pages that relate to some of the data that we already have on the platform, and we will be rolling those out in the coming year. Okay, approximately how much funding for each mini grant? So the funds will be capped at $3,000. We will be paying, so the idea is not only to have some data analysis done, but also to have students present the results of their analysis. So we will be providing funding for students to attend a conference and present their results at that conference. So the award will go to cover conference registration and travel, and then the remainder will go towards a stipend for the student. So exactly how much ends up being a stipend will depend on the cost of the conference and travel. Okay, we have a question about what are the most popular ways that your member cities leverage the platform and data, and who is your intended audience for the policy pages? So those are great questions. So in terms of our members leveraging the platform and the data, what we have heard from members is that they use the platform to benchmark themselves. So it serves as a way for them to compare themselves to other similar cities and to see how they're doing around particular health problems. Some of our members have even said that it's been useful in terms of justifying applications for funding for why they're, say, a city that is struggling with a particular issue. In terms of the policy pages, our policy pages, actually, wait, let me pause and go back. So we have also heard from other jurisdictions that are not members of the Big City Health Coalition that the data is valuable to them as well because they can also benchmark themselves. So while the data that is on the platform is limited to only those cities which are members of the coalition, it is publicly available and for use by anybody out there. And so any city or any jurisdiction can use it as a benchmark for themselves. Then in follow-up, the policy pages. So the policy pages are intended for anybody doing policy work. So our hope really is that both member cities and non-member jurisdictions, whether those are cities or counties or states, will take the information that we've compiled about these evidence-based practices and they will learn from what some of our member cities are doing and implement those in their jurisdictions.
And I would just add that, in addition to people working in governmental public health, these are also success stories that, we'd love for people working on various topics in policy or, in other sort of advocacy organizations to be able to see what's going on the ground level. And that's where those examples and stories about the cities come into play. So there's a question about indicator data being available in smaller geographic units at the county, zip, or other. We do not have the ability to do that. We get an estimate from our members and put it up there. On some of the publicly available data, Megan mentioned we have a number of things that come from the American Community Survey. You may be able to get those online, but right now, at least, we don't have the ability to do that. Let's see, there's another question about BCHC creating topical learning groups around certain conditions. I would say that we do some of that as part of our other activities with our members. They don't necessarily relate to the data platform. Sometimes they do, sometimes they don't. So Naveen, you can follow up with that with us on that if you have additional questions. And then I answered a question in the chat about the conference presentation as part of the mini grant. But just to reiterate that, basically as part of the application, we will be having people, talk about where they might want to present, and then also we'll likely ask people if they're available at some July dates for the NACCHO annual conference, because that would be our first sort of ideal place to put together a presentation or a panel, but we can be flexible, and again, that'll be in the application. Which software was used for producing the data platform's data visualization? So we had somebody basically build an app behind the scenes. That is, I think, the extent of the technicalities that we are able to share. If you have additional specific questions, again, feel free to follow up and we can try and answer that. I think we've answered all the questions in the chat, but we'll pause for a minute or so and let folks see either if we missed your question or if you have additional questions, feel free to put those in the chat. Okay, I see that several of you are typing, or at least Adobe Connect tells me several of you are typing. So we'll wait a moment to make sure we don't miss your question. Keith, can we work online over the next several months? I assume that's in response to the mini grant. It's not a disqualifying issue, so take a look at the application, explain that to us in the application, and we can consider it. So again, it looks like a few of you are typing, so we'll give you another minute or so. And again, we'll say it for like the 5th time, but you can definitely reach out to us as other questions come up or as you work either on the platform or with the data. If you have questions, we're happy to answer them, or suggestions. As we said, this is a living and breathing project, both with the data and the policy and practice pages, and we do want it to be useful to a number of audiences, our members, and others. So, again, feel free to reach out with questions or ideas. We actually right now have a little pop-up brief survey that if you are looking at the platform, you might wind up coming across. How closely or does the firearm-related mortality rates compare to what's reported? Sorry, Megan and I are writing notes to each other. So to be perfectly honest, we haven't crosswalked the data to the CDC reports. That could be a great application or proposal to do some work. The mortality rates are one of those things that we get primarily almost 100% from the cities. And so, it varies. Some cities get that from the states or some cities report it to the states. Again, it varies across the country. So we have not done that analysis, and we should be clear that we do not use these data to do any in-depth analysis. We use them as illustrations of what's going on in the cities, to draw attention to things, but we really see the coalition, our role as presenting data and again the policies and practices both to our member cities and to the public, and really look to others to do some of that analysis, where interested and applicable and timely. So again, a few folks are typing, so we're not going to hang up. But while folks are typing, we will again thank you for joining us. We really appreciate it. We will stay on and answer questions as others type, but I know sometimes people need to jump, so we just want to thank you for your time and your interest and your attention, and we will keep answering questions if and when they pop up. You might be interested. Yes, thank you, Lee. How were the 30 cities chosen and participate? So the cities that are on our website are our 30 member cities. We do have a few new cities that actually their data aren't up on the website yet. So I guess right now there's probably 26 cities listed there. The additional ones will come online soon. They just joined the coalition about 3 or 4 months ago, or 2 or 3 months ago. So those will come up. Basically, really briefly, the coalition has membership criteria, and you need to meet those criteria to become a member or to be eligible to become a member. So the current criteria gives us 30 cities. Okay, so I'm going to give a last call for questions as it doesn't look like anybody's typing. Of course, now somebody's typing. But again, we're happy to stay on and answer questions, but let us know as they come up. Yes, so the webinar was recorded. Anybody who registered will get an email with the link. It will be on our website either best case tomorrow, but definitely by early next week, and we will reach out again to anybody who registered and send that link. And again, you should feel free to follow up once you get that if you have additional questions. The website initially launched 2 years ago, almost 2 years, no, 3, no, 2 years ago. So I started the coalition almost 3 years ago, and we launched it almost a year later. So it's been online for about 2 years. We launched it in November of 2015. We're in our sort of 4th scope of work as we continue to add in bells and whistles to the platform. And again, that's thanks primarily to CDC for continuing to fund this work, as well as our other funders that fund the coalition as a whole. Okay, so thanks everyone. Thanks for your attention. Thanks for the questions and the compliments about the data and the site. We look forward to hearing from you. Do sign up for some of our communications so that you can learn as new things become available. And we'll also do these webinars every so often because we do want to make sure that people get to know about the updates and things like that to the platform.